The crowds, the food, the shopping, time spent with family. The holidays are here and they can be stressful. I'm Carol Vassar with the Hartford Healthcare Behavioral Health Network. Joining me right now is J. Craig Allen. He's the medical director for Rushford, which is an affiliate of Hartford Healthcare's Behavioral Health Network. Dr. Allen, why does it seem as though this time of the year is more stressful for people?
Well, one of the reasons it seems that way is because, in general, for most people, it is more stressful. There are a lot of demands that you don't have throughout the rest of the year that come about during the holiday season. But also I think, and there's been a lot written about this, that when people don't feel the way that they think they're supposed to feel, they can feel particularly bad, out of sorts, like they don't fit in. So when you're watching television or you're listening to holiday carols or you see carolers out in the street, you're thinking, boy, aren't they having a great time? I should be having a good time. And that can really be challenging for someone who may have lost a loved one or is thinking about a time that they had years past with people that are no longer there. That doesn't mean that you have to ruin your holiday, but acknowledging that to yourself and telling your friends that there are times you may need to take some space and think about what's not there and what's missing allows you to appreciate the rest of the season in a more full and open way.
So what are some signs of stress in the holiday season?
Well, signs of stress can be can be caused from eating too much or drinking in excess, not getting good sleep, being short-tempered, irritable with the kids or with other family members or people out in the community. Those would be some of the signs and symptoms that you might have.
And what can we do about that? If I'm feeling stressful, what are some tips that you can give us with regard to relieving that stress?
Well, there are things you can do ahead of time, and there are things you can do when it's happening. One of the things most people should factor in is being proactive and planning. Some people don't like to go to the mall after Thanksgiving because there's a lot of hustle and bustle, and there are other times that you can shop. Another way to challenge that stress is to look at the expectations you're putting upon yourself. This doesn't have to be the most perfect possible holiday, Christmas, Hanukkah season. This is supposed to be a time where you enjoy and you appreciate your family, your friends, and you look for the good in fellow man. So that extra gift, that last stocking stuffer, may not mean that much and probably has much more emphasis put upon it than reality would dictate.
And what about simple things like not disturbing your routine too much, getting enough sleep?
Remembering to exercise. Mm-hmm. You don't have to overeat every night. Make sure you get sleep. Make sure you get time to yourself. Make sure you get a chance to enjoy the holiday season. If you are feeling disconnected from other people, then seek people out. And there are other ways you can give back during the holiday season other than spending money. You can donate time to different service agencies, and there's plenty of opportunities for those kinds of things.
And if somebody can't handle the stress, there's always the option of professional help.
That's right. If you aren't able to feel better, if you aren't able to sleep, if you can't get out of bed, if you feel that everything is at its end, there's always professional help, and you can seek that through community health centers or your local behavioral health network affiliate.
Which would include Rushford and all of the Hartford Healthcare Behavioral Network affiliates. J. Craig Allen, Medical Director of Rushford, thanks for joining us today.
Thank you.
If you have any questions or would like to get a list of these tips that Dr. Allen talked about with regard to holiday stress, please visit us at our website, recoveryneverstops.org. I'm Carol Vassar for the Hartford Healthcare Behavioral Health Network. Thanks for joining us.